Hello students, welcome to Legacy IAS Academy. In today's video, we are going to discuss about a recently published report which made a lot of headlines, that is the World Malaria Report. Now obviously, what is the main points of this report and especially where does India stands as far as its fight against malaria is concerned, that is going to be our main topic of discussion. So first of all, to give you a brief background, the recently released World Malaria Report by the World Health Organization, it has shows that the number of cases and deaths due to mosquito-borne infection in India have continued to decline, with an estimated 33.8 lakh cases and roughly 5,511 deaths. India saw a decline of almost 30% in malaria incidence and 34% in the mortality in year 2022 if you are comparing it with the previous year of 2021. India's downward trend is reflected in the larger WHO Southeast Asian region that remained on track to achieving the 2030 target, where WHO is targeted to completely reduce the target cases and deaths by almost 90% that are a result of malaria. So, one thing that the WHO report has clearly stated that there seems to be a strong linkage between the pandemic, that is COVID-19 pandemic, and the malaria. The reason is that even as if talk about since the beginning of pandemic, a trend of increasing incidence has been observed. And this is not regional in nature. This is something that is being observed at a global level. And after nearly a decade of the numbers remaining almost the same, this worrying trend has begun. So, drop in malaria cases from 243 million to 233 million globally, it happened between 2000 to 2019. However, if you compare 2019 to 2020, we have seen an increase of 11 million cases of the malaria. Again, in 2021, it remained largely stable before seeing another increase of 5 million in 2022, 249 millions. Thus, what we can say, the number of deaths, since the incidence of malaria has increased, number of deaths caused by malaria also remained higher than the pre-COVID levels, or what we can say is pre-COVID pandemic level. There were overall 608,000 deaths that were reported in year 2022 as compared to 576,000 cases in year 2019. And especially in this regard, the contribution of Africa has been humongous. The African region, as we can see, has remained hardest hit region by malaria. And in 2021, if talk about, region carried 96% of the all global deaths that has happened due to malaria. That is almost a humongous figure of 593,000. Similarly, in terms of the number of cases, African region itself has contributed to 95% of all cases at a global level. So this is the area that should be a focus region as far as the WHO report is concerned. Now here, India's success story is something that we have to witness, that we have witnessed and we have to understand. So if you look at the expert suggestion or experts belief, they believe that a lot of innovative practices that were carried forward by the government machinery, both at the central level, at the state level, or even at the local level, has contributed in a stellar success of India's fight against malaria. For example, India focused on providing primary health care to the remotest regions of the country. Similarly, it has continuously engaged its machinery in surveillance, and not general surveillance, but surveillance that is backed by data and the changes in the data. And third, extreme weather events, that is something that happens every now and then in India. For example, the cyclones, the floods and drought, we have been able to handle them better, especially after the passage of Disaster Management Act of year 2005, coming up of NDMA, and also deployment of NDRF as a quick reactionary force in the areas that are shaken by disaster. So these three innovative practices have caused a lot of, what you can say, have contributed a lot of positive things in controlling of malaria. And thus its result can be seen in the facts that good preventive practices that has been basically people were made aware of. If we talk about initial times when people were not so much aware about how malaria is spread, how to prevent it, a lot of this ad campaigns were launched on the national television, radios, newspapers, and also at a local community level. So these kind of preventive practices have also helped in bringing down the cases related to malaria. Apart from that, use of effective tools to keep the mosquito population in checks, use of point of care test for the quick diagnosis, as well as good management of the malaria cases. These three innovative practices and these 4 steps that has been taken by the government of India is the reason behind the India's success story. However, if you look at the malaria report that is published in this particular year, these are the major takeaways of the report. The first point that we can see that India had seen a decline of 30% in the malaria cases and decline of 34% in the deaths in year 2022 as compared to year 2021. Second, globally, there were 5 million additional malaria cases in 2022 as compared to previous year that totaled to almost 249 million cases. Third, of the 5 million additional cases, the highest 2.1 million was from Pakistan that had a flood in year 2022. And from now we can understand that there is a strong linkage between the extreme weather events and the incidences and cases of malaria. The reason is very, very simple. Whenever there is a flood-like situation, we have the stagnant water that develops here and there, and it is the stagnant water that is a breeding ground for the vectors, that is mosquito, that carries these malarias, and that is why we see a sudden spike in the number of cases of malaria in Pakistan. If you look at the contribution of India, it has accounted for almost 1.4% of total malaria cases in the world, and it accounted for 1.4%. It accounted for total 1.4% of total malaria cases in the world. Now, the question that comes into mind is how climate change can influence the spread of malaria, or will have it any positive or negative impact on the malarial cases. So, first of all, we know that malaria parasite as well as the mosquito, the vector that carries malaria, are both extremely sensitive to the climatic conditions, climatic parameters such as temperature, humidity and rainfall, and that is why experts always worry about expanding reach of diseases with the climate change. For example, the report says that climate change will not only directly increase geographies for malaria spread, but also indirectly affect the impact of the disease by reducing access to healthcare facilities and timely treatment. Now, let us try to understand this. Basically, we have discussed that whenever there is a climate change, it is largely driven by global warming, and global warming is caused due to rise in the greenhouse gases. So, as a result of this, we will see increase in the atmospheric temperature globally all across the world. Thus, as temperature increases, more and more areas, especially in the Himalayan belt, if we talk about India, will become more suitable for the spread of diseases, as these diseases spread faster and the mosquitoes grows at a much more faster rate in the warm climatic conditions. And the case study of Pakistan, obviously we can look at here. The standing water that developed after the floods became ideal breeding ground for the mosquitoes and led to 5-fold increase in malaria cases in the country. Similarly, the floods destroyed infrastructure and isolated millions of peoples across the country, hindering medical access and increasing the risk of disease. And this exactly is the point that we have discussed. WHO says that it is worried about. Let us try to understand this by looking at the map of the world. Now, if you look at the present conditions based on the climatic conditions, the green areas that you see in the map today are the areas where we have current distribution of falciparum malaria, that is parasites causing malaria. However, if you look at year 2050 and if you take into account the climate change and its impact, we can see some of the areas which are shown in the red zones will also become suitable climate for the vector and parasite. That means you can see many areas in USA, especially around the Gulf of Mexico region, around upper part of British Columbia in Canada. Similarly, we talk about in the some of the European regions, Turkey, China, all the way up to Southeast Asia, such as Vietnam and all these countries. So, a lot of areas, even if we talk about Australia in the southern hemisphere. So, if the climate change is not controlled, these additional regions will also bear the brunt of malarial parasites and the increase in the incidences of such diseases. Now, in this regard, since India obviously has shown a very healthy trend in controlling the disease, our experts believe that there is still a need for improving surveillance. And the reason behind is very simple, that whenever there is a burden of disease very higher, you have a lot of cases, information about these cases are coming at a regular interval, and thus it is much more easier to report such cases and take action, and thus have a drastic reduction in the numbers. But it is when the numbers start to go down, the cases are scattered. That means the few cases will be from one state, few cases will be from other state, few cases will be from the different district of the state, and in that case it becomes very, very difficult to find the pockets where malaria has spread it out. And if it is not properly mapped, in that case the role of surveillance, if it is not properly mapped, obviously what will happen, the area will keep on expanding, and again we can see the upsurge in cases of malaria. And that is why the need of a role of surveillance comes in, because it is important to have real-time digital data of these cases to help local administration better plan the interventions, rather have a central policy or a unicentric approach, we can say. And despite all the successes that we have achieved, there are several challenges that India might have to face in the coming times. For example, the malaria resistance is one of the major challenges that experts believe can derail the train of reducing the cases of malaria by 90% by year 2030. So the biological threats that belong to categories such as drug resistance, insecticide resistance, gene deletions in parasite, which make diagnosis very, very difficult, whether it is malaria or whether it is some other diseases. Another challenge is vivax malaria. This accounts for almost 40% of malaria cases in India, and it is known to hide in the liver and cause recurrent infections. And thus, if the number of vivax malaria cases increases, then obviously what will happen? The number of upsurge, or what we can say the upsurge in malaria cases, can also be observed again. Thus, there is need of updating policies and adopting new tools as per national and sub-national need in the line with WHO guidelines is very, very critical. The last point is that is there any scope for development of malarial vaccine? The answer is obviously yes. A lot of work is being done to develop a vaccine against malaria. However, it will require huge investment, and not only investment in financial sense, but also collaboration of multiple stakeholders, stable high quality infrastructure, and long-term financial support from the government and other agencies. And if you look at, especially if you remember the map that we have seen in the beginning, where the malarian cases are very, very higher, largely it is the tropical and equatorial region, which covers most of countries situated in Asia and Africa. So it seems quite clear that the current and future vaccines that need to be rolled out in which kind of countries? It need to be rolled out in lower and middle income countries. And since lower and middle income countries, they cannot afford a huge price or high price for the malarial vaccines, it cannot be prepared by MNCs that are sitting in Western countries, because their motive is largely to make a lot of profit, and they will not want to invest their resources for a smaller return on their investment. And thus, mostly such vaccines will be manufactured by pharma industries that is situated in India, which is also a hub for the generic medicines. And that is why experts argue that it is a right time for India to invest, integrate, and be the leader in finding solutions in combating the deadly infectious disease such as malaria in case of not only India but also at a global level. So that is all about this particular video. I hope you understood the gist of the World Malaria Report 2022. Thank you very much.